herd immunity basically means if you could envision a circle, let's say of 100 people inside this circle, and if you could imagine the susceptible people being in the center of that, the more immune people around the susceptible people, the less likely the virus can penetrate in and actually infect somebody. We know with influenza that number's somewhere in the 60%. With measles, it's about 95%. Coronavirus is probably going to fall into that neighborhood of 70-ish percent or so. There are really only two ways. You became immune because you got infected. And in the context of COVID-19, that means you have to be willing to accept a lot of severe illnesses and even deaths to get there. Or you have a strategy like a vaccine, where you can, in a sense, artificially make somebody immune by tricking the body into thinking that it has seen the virus, made antibody, and that antibody be protective. So we have two options. One is, and you've seen some countries do this, say no restrictions, we're going to go for herd immunity. You look in Scandinavian countries, for example, some of them have done that. They've had very high death rates. Other countries have not done that. They have very low death rates. The consequence of saying we're not going to go for that, we're going to do social distancing, is that we have to wait for the vaccine. That means we have lower number of cases, but we push them out longer. So we don't overwhelm the medical system. At some point, we have therapies or a vaccine and overall reduce the burden of infection.